My name is John Flett. I'm a pediatrician, been in practice a long time. I specialize in ADHD and I prescribe a lot of medication. So one of the biggest questions I get asked is, how long is my child going to be on the medication, specifically at the diagnosis? And after a while, parents want to know, when is my child going to come off this stuff? I don't like it. It's expensive. I've got to keep getting prescriptions refills. I've got to take my child for lots of appointments. Is it really necessary? So I'd like to share with you some of the most important reasons that you should take this seriously and also not just suddenly stop the medication. Starting this year, I've had a lot of parents who have come back for the appointments, and sometimes they've come back because the teacher has said, does your child have ADHD? Are they still taking their medicine? And they're having to come back as a grudge. They don't really want it. And there are a lot of parents who I don't think really understand the importance. So the key is being educated and understanding why your child's on medication. A lot of parents think, well, let me try and stop the medicine because, look, my kid's doing okay. They're doing okay. Their grades are okay. I haven't had any calls from the teachers. No news is good news. And if the teacher's so smart and this medicine is so good, let them work out whether my child needs to be on the medication. I'm just going to wait until there's a problem. That's kind of like sticking your head in the sand. It's like saying my diabetic medication ran out and now I'm at a diabetic ketoacidosis and maybe it's not that mild. Maybe it's going to have a long-term effect. So I'd like to tell you why the medication is often stopped and why you should think about these things and what is the logic behind getting the medication helping your kid. You need to understand that this is a medical problem. This is not some psychological problem that can be just dealt with lots of chatting with a psychologist. No, it's not. It is as much of a medication problem or a diabetic medication problem as diabetes. Of course, it's not diabetes, but it's a neurochemical problem. So what I want to help you understand is that, the medication can be lifetime. It can be a lifetime. It may not. The symptoms of ADHD disappear and change over the lifetime of a child and an adult. And a child that's hyperactive, busy, doesn't always remain that way. They might not need the same medication as they mature and get older. And when you stop a medicine, you're not going to see the difference the next day necessarily. Some children have the non-disrupting type of ADHD, like girls, and the inattentive type. And you're going to see that several months later when there are huge problems with maybe working difficulties, results, grades, and of course, social issues, and then of course, self-esteem problems. So these are the couple of things that I think we should talk about, the impact of medication. It's the cornerstone of treatment. It helps your child unlock their brain. It helps them being available for learning. So without medicine, you kind of disadvantaging them. It's kind of causing suffering in the first place if you don't have the strategy of when to start and when to kind of have guidance about medicine. A child grows right up until the age of 16. Their bowel changes from a child to an adult. So the absorption, the way it works is different. They gain weight. They also have to become more socially responsible. They learn more. If they've got learning problems, academic problems, social challenges, those things are going to kind of come up where they might not have in the past. So these things need to be checked. And of course, if you have a child who suddenly is on this amount of medication and they grow, you're kind of diluting out the medicine. Maybe they need more. Maybe they've got other problems. Parents often say, I'm going to give it a break. I want their body, I want them to be themselves. I want them to, have a chance to see how they do off the medicine. Well, first of all, make sure that your child's on the right medicine. If they're not really unlocking their personality, if they're too quiet, that it's causing too many side effects, that needs to be solved, not necessarily taking off the medication. So remember, medication is just one tool. Therapies like lifestyle adjustments, skill building, eating, sleeping, exercise, Those things have to be done in tandem because the medication is never going to just be a one size fit all. Children that are anxious, the medicine is not an anti anxiety drug. So those things need to be dealt with different skills and different interventions. So don't think that the medicine's not working because it's not solving your child's spelling problem. It's not dealing with the coordination problem. You know, they've got lots of other problems and these need to be dealt with holistically. So don't think about the medicine as either solving a problem or not solving every problem. And also keep yourself updated. There's lots of research, just like sleeping during the nights that are weekdays and weekends, called that social jet lag. Just keeping the times of sleeping the same makes a big, big difference. And then try and get hold of a doctor who understands this, who deals with it all the time. Somebody who deals with it almost exclusively is going to be better. So they kind of have a good understanding of new medicines, changes, availability of medicines in pharmacies, and how you've got to get a feel for the medicine as to how it works. So I hope this gives you an indication that it's important to get help, get hold of an expert that understands it. And if you've got any worries, let us know.